In this podcast, Dr. Ken Alibek discusses why many children with autism experience significant gut-related issues and explores when these problems may begin. He shares insights into the connection between gut health and autism, offering perspectives on the possible origins and early development of these challenges.
Hello, Dr. Ken. Thank you again for taking time to meet and speak. And today I would like to speak about one of the most important topics in autism community, about microbiome and autism. So we have some questions for you. So the most important is why so many children with autism have gut problems, and if treating gut issues can improve speech, behavior, and cognitive function.
In my opinion, yes, it's a really important question, and I will try to address it as detailed as possible. First, when we talk about microbiome, first we need to understand what it is. Microbiome is a accumulation or a combination of all bacteria, fungi, viruses in the gastrointestinal tract. Microbiome is important from 2 points. First, it plays a role in the formation of normal immunity, and definitely the major function of microbiome is to participate in digestion of the food, let me say, and the removal of some pathological things from the gastrointestinal tract. And just when people say that microbiome is a major, the major problem in autistic children, no, it's not the one. Microbiome, I would say, is secondary to many other problems, mostly, I would say, in the brain. Okay, because when the brain is the organ which is thinking, which is responsible for cognition, for understanding, for motor skills, and all the things. Microbiome is important from the point that it has so-called direct connection to the brain through so-called the brain axis. Because we have several things, ways how microbiome from the gastrointestinal tract can be connected to the brain. And from this point, microbiome is important. Microbiome plays secondary, but at the same time important role in autistic kids. Okay, playing a role, let me say, in worsening the state, you will have wrong microbiome.
But why so many, I would say 90%, why they have problems with the microbiome and lacking good microbiome, are overloaded with bad microbiome, and what is happening? What is the reason?
If we understand what is actually is inducing autism, what is promoting autism, of course, it's I can name 3 major things which would be absolutely essential to understand in autistic kids. It's the immune system status, then the presence of inflammation, types of inflammation, then severity of inflammation, and the third, let me say, is infectious agents involvement.
And this inflammation, is it of brain inflammation?
No, I'm talking just at this point, I'm talking about systemic infections. Like mycoplasma, like chlamydia, like streptococcal infections, then brain, or some other infections which are affecting the brain and the gastrointestinal tract. They include a big number of viruses, some bacterial agents. These are 3 important things.
Okay, but are those pathogens causing inflammation?
Yes, of course. And the question is what is the role of microbiome and why microbiome is I would say not wrong, but it's related. There is a simple explanation, because microbiome is appearing after we are born. Okay, in this case, but if the child is born with the immune system which is dysregulated, it means the immune system is not able to protect from the formation of pathological microbiome, because the immune system is supposed to detect so-called non-self invaders like pathogenic bacteria and must kill them. If the immune system is not working properly, the formation of microbiome is taken, let me say, the way in which we have a bigger combination of normal bacteria and pathogenic bacteria altogether, not just bacteria and fungi. Okay, that's the case. Because the microbiome is formed the wrong way, because the immune system is not able to protect the child from this formation.